At least 1 in 23 people will face the stealthy threat of colon cancer in their lifetime. While it often sneaks up silently, leaving no early traces, your body can send subtle warnings. But before we delve into these 8 critical signs, let's understand what causes this silent killer to take root in the first place. Colon cancer, also known as colorectal cancer, isn't a sudden event. It's a slow-burning process that usually begins with tiny, non-cancerous growths called polyps forming on the inner lining of the colon or rectum. Over time, some of these polyps can transform into cancer. The exact reasons behind this transformation remain a mystery, but several factors play a role. One key player is your DNA. Changes or mutations in certain genes can disrupt the normal life cycle of cells in your colon, causing them to grow and divide uncontrollably. These renegade cells can then pile up, forming a tumor. Your lifestyle choices also matter. A diet high in red and processed meats, low in fiber, and excessive alcohol consumption can increase your risk. A sedentary lifestyle and obesity also contribute to the equation. Other factors like smoking, certain medical conditions, like inflammatory bowel disease, and a family history of colon cancer can further tip the scales. It's important to remember that colon cancer isn't always preventable, but understanding these risk factors can help you make informed choices about your health. Regular screenings, starting at age 45 or earlier if you have a family history, can detect polyps before they turn cancerous, offering a crucial opportunity for early intervention. Now, let's explore those 8 critical warning signs your body might be sending. Number 8. Persistent abdominal pain and cramping. Often mistaken for ordinary tummy troubles, persistent abdominal pain and cramping can signal a more sinister issue. While gas, indigestion, or even just a bad burrito might be to blame, these discomforts could also be your gut's way of raising a red flag for colon cancer. You see, as a colon tumor grows, it can start to squeeze or even block your intestine. This creates a traffic jam of sorts, causing stool and gas to back up, leading to those nagging aches and cramps. Sometimes it might feel like a dull ache, other times a sharp cramp. It could be mild or so intense it stops you in your tracks. And it might be joined by bloating, that uncomfortable feeling of fullness, even after a light meal. Now don't panic at the first sign of a stomach ache, we all get them, but if the pain sticks around, won't quit, or gets worse, especially if it's paired with other changes like unexpected weight loss or a shift in your bathroom habits, it's time to take it seriously. Your doctor is your life savior here. They can run tests, like CT scans or a colonoscopy, to see what's really going on. Early detection of colon cancer can make all the difference in the world, so if your gut is sending you distress signals, don't brush them off. Talk to a doctor and get the answers you need. Number 7. Blood in the stool. Seeing blood in the toilet bowl can be alarming, but it's a sign you should never ignore. While it could be due to less serious issues like hemorrhoids, blood in your stool, whether bright red, dark, or even hidden, might be a message from your colon. Colon cancer can cause bleeding in a couple of ways. The tumor itself might bleed as it grows, or it might irritate and damage the lining of your intestine. Sometimes, this bleeding is obvious, coating your stool or turning it a dark, tarry color. But sometimes, the blood is microscopic, invisible to the naked eye but detectable through tests. Remember, not all colon cancers bleed, and not all bleeding means cancer. But it's always worth investigating. If you spot blood, don't hesitate to talk to your doctor to find if it is cancer. Don't let fear or embarrassment stand in the way of your health. Number 6. Unexplained weight loss. Unexplained weight loss, that is, dropping pounds without trying through diet or exercise, can be more than just a welcome surprise. It can be a red flag for colon cancer. When a tumor takes root in your colon, it can interfere with how your body processes food. This disruption can lead to poor nutrient absorption, causing you to lose weight even if you're eating normally. Additionally, your body might start burning muscle and fat for energy as it battles the cancer, further contributing to weight loss. It's important to be aware of any sudden, unintentional weight loss. If you lose more than 5% of your body weight within a few months, without any changes to your lifestyle, it's time to consult your doctor. While this could be due to other conditions like thyroid problems or diabetes, it's crucial to rule out colon cancer, especially when combined with other symptoms. Number 5. Unexplained fatigue and weakness. Feeling exhausted all the time, even after a good night's sleep? Unexplained fatigue and weakness that won't quit can be more than just a sign you need more rest. It could be your body's way of alerting you to the presence of colon cancer. As this disease progresses, it takes a toll on your body in many ways. The tumor itself can disrupt your normal bodily functions, making you feel tired and weak. Additionally, colon cancer can cause internal bleeding, leading to anemia, a condition where your blood doesn't carry enough oxygen to your tissues and organs. This lack of oxygen can leave you feeling drained and sluggish. On top of that, your immune system is working overtime to fight the cancer cells, using up precious energy that would otherwise keep you feeling vibrant. Even the emotional stress of dealing with a cancer diagnosis and treatment can contribute to fatigue. While there are many reasons for feeling tired, persistent fatigue and weakness that interfere with your daily life shouldn't be ignored, especially if accompanied by other symptoms. If you're constantly feeling run down, talk to your doctor. They can do tests to check for anemia or other underlying causes and get you on the road to feeling like yourself again. Number 4. Iron-Deficiency Anemia. Have you noticed that your iron levels are low, even though you're eating a balanced diet? Or maybe you've been feeling unusually tired, weak, or short of breath. These could be signs of iron-deficiency anemia, a condition that can sometimes be linked to colon cancer. When a tumor develops in your colon or rectum, it can slowly bleed over time. This chronic blood loss might not be dramatic enough to notice in the toilet bowl, but it can gradually deplete your body's iron stores. Iron is essential for making hemoglobin, the protein in red blood cells that carries oxygen throughout your body. Without enough iron, you can develop anemia, which leaves you feeling fatigued, weak, and short of breath. Other symptoms of iron deficiency anemia include pale skin, dizziness, and cold hands and feet. While this type of anemia can have many causes, but checking on with a doctor would tell the real cause. A simple blood test can check your iron levels, and further testing can determine the cause of the anemia and whether colon cancer is a factor. Number 3. Changes in bowel habits. A change in your usual bathroom routine might seem like no big deal, but pay attention if those changes stick around. Colon cancer can disrupt your bowel habits, causing things like more frequent trips to the bathroom, persistent constipation, where you just can't go, or even changes in the shape of your stool, like narrower stools than usual. These shifts can happen because a tumor is growing and obstructing your bowel. It's like a roadblock that makes it harder for waste to pass through smoothly. If you're also experiencing abdominal pain along with these changes, it's even more important to talk to your doctor. Don't wait if your body is trying to tell you something. It's better to detect it early instead of risking your life. Your doctor can help you understand what's happening and get you the care you need. Number 2. Nausea and vomiting. While an upset stomach every now and then is normal, experiencing frequent nausea or vomiting that doesn't seem to have a clear cause can be a warning sign. These digestive troubles can sometimes be linked to colon cancer, especially when combined with other symptoms. There are a few reasons why colon cancer might trigger nausea and vomiting. As the tumor grows, it can partially or completely obstruct the bowel, preventing food and fluids from passing through normally. This blockage can lead to a buildup of digestive contents, causing nausea and vomiting. In some cases, cancer treatments like chemotherapy or radiation therapy can also cause nausea and vomiting as a side effect. It's important to remember that nausea and vomiting are common symptoms with many possible causes. But if you're experiencing these issues regularly, especially if they don't seem to be related to a stomach bug or something you ate, it's important to see your doctor. They can help you determine the underlying cause and recommend the best course of action. Number 1. Feeling of fullness or pressure in the lower abdomen. A feeling of fullness or pressure in your lower abdomen, even after a bowel movement, can be a subtle yet significant sign. It can sometimes feel like you haven't completely emptied your bowels, even after going to the bathroom. This sensation can be accompanied by a frequent or urgent need to have a bowel movement, even if there isn't much to pass. This discomfort can occur due to a tumor growing in the colon or rectum. As the tumor increases in size, it can partially block the passage of stool, leading to this persistent feeling of fullness. In some cases, the tumor might also irritate the lining of the bowel, triggering a sensation of urgency to have a bowel movement. It's important to listen to your body and pay attention to any unusual or persistent changes in your bowel habits. While a feeling of fullness or pressure can be caused by other factors like constipation or irritable bowel syndrome, it's crucial not to ignore this symptom, especially if it occurs along with other warning signs of colon cancer. If you're experiencing this discomfort, don't hesitate to consult your doctor. They can conduct a thorough evaluation to determine the cause and recommend appropriate treatment. But remember, knowledge is power. Armed with this information, you're better equipped to spot these warning signs and take action. If any of these symptoms sound familiar, don't hesitate to talk to your doctor. Early detection is key to fighting colon cancer, so stay vigilant, prioritize your health, and remember, you're not alone in this journey.